You're listening to an interview entry of Getting Stuck the Way We Do. I'm Jared E. Over the past few years of my therapy journey, I've noticed patterns of behaviors in myself that might be unhealthy. Traditional talk therapy has been my way of discovering these issues that I'm addressing, and this project, a manifestation of that. During research for this project, I came across a form of therapy that works with you to address traumas without getting caught up on the pain of those traumas. Initially utilized for PTSD and now used more broadly for reprocessing traumas. EMDR, or eye movement desensitization and reprocessing, operates on the principle that the brain can heal from psychological trauma much like the body recovers from physical injury. When a traumatic event causes a mental block, EMDR uses bilateral stimulation, primarily through eye movement, to root the patient in the present, allowing the patient to reprocess painful memories until they no longer trigger intense negative emotions. Joe Huey is a therapist at Present Awakenings in Chicago and has been using EMDR, among other therapy styles, to help his clients recognize their own strengths and achieve their goals. Thank you for joining us, Joe.
Today, I have an interview with Joe Huey, an EMDR therapist and specialist. Thank you for joining me, Joe.
Thank you for having me. It's great to be here.
So, for the listeners, in your own words, please explain a little bit more about what EMDR therapy is.
Yeah, absolutely. I'll give you the short version. We can do the long version later. But EMDR therapy is essentially a type of therapy that utilizes reactions our brain has when we utilize the eye movements back and forth. And it allows us to process traumatic memories that are disrupting our lives and preventing the natural healing process that our brains usually go through.
Hmm. So, what types of people typically seek out EMDR therapy?
It's most often used for situations of PTSD, especially if there is what we call complex PTSD. That's when there's been traumatic experiences of a certain nature over and over. So if you think about the classic PTSD as someone who's been in a near-death experience, this would be someone who's been in multiple near-death experiences or multiple violent situations. It tends to reinforce negative views they have about themselves, the world, their bodies react in different ways. And so EMDR is really helpful in those situations because it can unpack a lot of those traumas.
So, how is it that somebody comes to the conclusion that EMDR is appropriate for them? Is it a frequent situation of they're already in another form of therapy and they're told about it, or do you frequently have people coming to you directly for EMDR treatment?
Probably most often is the first one. Most often is someone who was recommended to EMDR, or probably most often is someone whose friend did EMDR, said it went very well, and then they wanted to give it a try. So there are a lot of people who come in specifically seeking out EMDR. Now, that's not everyone. Many people come in seeking out the other more traditional forms of therapy, and over time find that EMDR would likely benefit them.
And you do practice more than just EMDR.
Absolutely.
How does that factor into your approach to therapy? Being so
Well,
specialized and knowing more traditional forms.
yeah, I think there's a lot of therapists. I think it's much more old school thought to really just only do one type of therapy. Most therapists nowadays really like to do what we call the integrative approach. We're pulling from a bunch of different things, and it can have some bumps in it because some of these styles don't all mesh together. But the big thing is every client's different. Every client's needs are going to be different. And especially as much as I do tout EMDR is a fantastic form of therapy, research has shown time and time again the number one predictor of whether therapy will be successful is how good the relationship between the client and therapist is. So if the client feels that they can trust the therapist to be open and not feel judged, And if using any more traditional form of talk therapy of lying back on the couch and just saying what comes to mind helps them get to that place of feeling safe and vulnerable, then that is just going to do so much for the process. And so I often do a lot of integrating those things, bring in therapy styles that will help make people feel comfortable, or help them feel like they're being fully heard and validated. And then having EMDR added in when there's a place of safety and comfort to really work into those deeper traumas.
So if I'm reading between the lines, um, very, I would imagine very rarely would you have a first session with someone um, and start immediately with EMDR.
Almost never. I will say there are times EMDR has been, they've done some specialization with it, so it can actually be used in crisis response. The big example is, I believe, it was the Oklahoma bombing. This
Hmm.
was years ago, but big terrorist attack in America, and EMDR specialists basically put together a form of EMDR that was like on the ground, meeting people and immediately doing it. That is actually a form of EMDR we'll do. So there are times, first session, I'll do EMDR. That's really only for recent trauma. Basically, if they've had a trauma in the past 3 to maybe 6 months and it's immediately impacting them, like they can't really sit through a few hours without feeling the trauma, then I'll do it. That's a rare case.
Hmm.
You're exactly right. 99% of the time, I'm not doing EMDR for a session. It is way more about making sure we feel comfortable with each other before we do that.
Hmm. So um, what is it about EMDR that inspires growth in a different way compared to more traditional conversational therapies?
Yeah, and so I'll be honest here, as I
Hmm.
like to be honest with all my clients about this. We certainly know that EMDR does work, and we know the ways that it works. We actually haven't really proven the why yet. Like,
Oh.
why does EMDR work?
Hmm.
Now, I also let all my clients know. An example of, there are a lot of things that we use in, the healing practice that we don't know why they work yet. I believe it was 2022 is when they actually proved why general anesthetic works for surgeries.
That recent.
That recent. And as you can probably guess, we've been using it much earlier than 2022. So it's a funny thing of science usually figures out the why after like figure out that it does work.
Hmm.
But so the main theories as to why it works and the models we use is what we call the adaptive information processing model.
Okay.
The idea that your brain heals itself. Your brain is like its body, it heals itself, it does its own work to overcome things. And when we are faced with trauma, that disrupts that process.
Hmm.
The traumatic memories don't go in smoothly. They have bumps, they have quirks, things that tug and pull at our mind. What EMDR does, and one of the big theories is that it works similar to REM sleep,
Okay.
that rapid eye movement portion of sleep. The theory that it essentially is taxing your working memory while dealing with your long-term memory. And I know I'm throwing a lot of terms. So working memory, that's sort of your short-term things that have happened in the past 3 months.
Hmm.
That's your memory of, did I take out the trash last week?
What did I have for dinner?
Exactly.
Okay.
But if I asked you, hey, what did you have for dinner April 4th, 2016? You're probably not going to remember. Your brain is sort of sorted through what memories should stay and go into what we call the long term. Those are the memories of what was it like when I first heard my favorite song.
Hmm.
The core memories we've really sat with. When someone is revisiting a traumatic memory, they are often going into that long term. And like I said, with that adaptive informational processing, that traumatic memory, it has its bumps, it has its quirks. So when they go back in, they're reliving it. It's bringing up all this pain, all this suffering. Our body sensations are activated. Our basically, we feel like we're in survival mode. We're going to die.
Mhm.
So what EMDR does is using the eye movements, it is taxing your working memory.
Mhm.
So you're not able to fully relive the past because a part of you is getting rooted in the present. We call that the dual awareness. So you're kind of like in the present and the past. So you can revisit a traumatic memory without fully reliving it and thereby decreasing the distress that comes from it.
So by rooting a patient in the present with the eye movement, you as a therapist are then able to work through the traumatic memories with the patient without them getting caught on the actual bumps of the trauma itself.
Absolutely. That's 100% correct. Well, and there's one piece I actually didn't get to add yet.
Hmm.
Everything I just described is how EMDR was originally created.
Okay.
Is actually we used to call it EMD, which is eye movement desensitization.
Hmm.
Back then, it was only being used just so people wouldn't feel as much distress about memories. Just desensitize, it's not going to be as scary. As the research kept going, that's when we added that R,
Hmm.
which is reprocessing. The discovery was that not only were people able to go back, look at these memories because they're rooted in the present, not feeling it as much, but when they were in this safer place, their brains were actually able to start making whole new connections. So, a big thing that happens in EMDR is actually the therapist is really not saying as much. It's actually the client who's doing the healing themselves. An example would be like a client who, let's say I'm feeling a lot of guilt for some memory that happened. I blame
Hmm.
myself for a car accident.
Hmm.
And I feel a lot of stress about the memory. So we start going into it, and as I'm doing, I'm not reliving the car accident every time I get behind the wheel. I'm not feeling as worried. But as I'm not feeling as worried, my brain starts to start having thoughts, and I'm kind of like surprised by them as it's happening. I'm like, oh, well, I start thinking about what I was eating that day. I start thinking about like what else was going on that day. Why is that? And you keep going, and then slowly your brain will make these connections of, oh wait, and now I actually remember I wasn't the one who was driving recklessly, it was the other person. And I actually remember that there was all these other things going on. It wasn't really entirely my fault. And you start to make all these connections that are not just basically like, hey, don't be as worried, but also like now they're actually healthy and adaptive and they actually make you feel more empowered about yourself. And that's the reprocessing. We've taken a traumatic memory and made it healthy.
So, and in your example of the car crash,
Hmm.
the how do I want to phrase this? The reality might be that the person who feels guilty about the car crash might not have been the one at fault.
Hmm.
Um, but they feel that because of in the moment circumstance and then what we tell ourselves in the aftermath. So when someone goes to a therapist like yourself for EMDR, that tool of the eye movement helps them step out of the stories that they told themselves and maybe think, um, or I guess, patch up their memory about what actually happened.
Absolutely. Yeah. And because truly, we often say trauma is not the thing we experience, it's how we felt about it. And so
Mm,
it really does, yeah, like you said, they get to step out of the narrative that they had and maybe make some new connections,
mm,
new points. Because even if it was the car accident was their fault, you can still have that moment where you say, yeah, maybe it was my fault, but that doesn't mean it has to happen again.
mm. So even if it's a situation of the car crash was entirely their fault, the EMDR isn't so much for the sake of um, getting rid of or forgetting about that trauma, but more so learning a way to um, live with that feeling and not let it occur again should a similar situation arise.
Exactly. when major things happen to us, it is going to change how we see the world.
Hmm.
EMDR helps to find places where that change was negative and turn it into something that is more adaptive, more effective for improving our lives.
So in another way, EMDR inspires um, positive self-talk or positive um, mental narrative writing.
Yeah, 100%. We actually have a term for that. We call it the positive cognition. The idea that a lot of when trauma happens, it doesn't just affect our emotions or our body, but it
Hmm.
affects our mind and our self-talk. We call that the negative cognition. So something saying that like I am at fault, I am to blame. And we use the car crash example, but this can happens a lot with, you know, early childhood sexual trauma
Hmm.
or, you know, again, like survivor's guilt or just all these different things where we will feel I'm at fault or the world is unsafe or I am not worthy. These are these negative thoughts and it's that
Hmm.
self-talk. You might not realize it, but it's like it's there and it keeps kind of talking to you. That EMDR helps to not only unroot that, but as you were saying, bring in a new positive cognition, something that counters it, like I am worthy, I am safe, I am deserving of forgiveness, or I can move on from this.
So the actual technique of EMDR allows for patients to enter that space of positive cognition. Um, but how do you as a therapist actually coax them, or I guess I should say, help them to stay in that space instead
Mm,
of, you know, slipping back into negative cognition?
absolutely. It's a great question. And truly that's where EMDR goes from more of the science to more of the art.
The
Um,
art.
Yeah, all of therapy is a bit of an art.
Okay.
There is a reason that to become a therapist in, grad school, internships and your practical application are so important. Is the theories are great. I love the theories, but it's in the practice that you learn everything. And
Hmm.
so it's fine when EMDR is going very easy. I will often have clients, kind of say like, "Can't believe I'm paying you for this. Like I'm the one doing all the work." And it's like, yeah, true, until it doesn't go easy. And that's where I am here for those moments where I use my clinical judgment and I can kind of tell like, ooh, we'll sometimes get into like these feedback loops of just the guilt, the guilt, the guilt. And we'll kind
Hmm.
of have to like, so there are things I use. So we have so many different techniques to do it. A big one is like what we call a cognitive interweave. So it's like basically a little thing we throw in there to be like, kind of disrupt that train of thought or
Hmm.
try to coax it somewhere new. A lot of different techniques, even like with the eye movements. So that's why we use a lot of other things. So we do, there's auditory and like tactile.
Hmm.
So for example, if I have a client who's maybe kind of stuck in the same train of thought, I might say like, okay, I want you to close your eyes and I want you to start tapping like this instead of doing the eye movements.
So it's a
Or
similar, you might shift it to a similar sort of repetitive place to root them in reality, but not necessarily the eye movement, which they might currently be stuck in the same loop of guilt, 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 for example.
absolutely. And as long as the movement is back and forth, so it's like, either side or like kind of this tapping, like as long as it's back and forth, research seems to show that it does the same thing.
Hmm,
I will say these techniques are more recent, so like
sure.
research a lot more on the eye movements, but yeah, we'll switch things up. Maybe we'll do two at the same time. Hey, look side to side while we're doing this. Anything that, like we'll do different little techniques to try and shake things out. And sometimes it is, hey, we're gonna take a break from EMDR. We're gonna do some talk therapy.
Hmm.
Maybe we need to feel a bit safer before we go into this.
So I find that really interesting that even when it's not eye movement, it's still um, engaging the two halves of the body. Is there something to that? Or yeah.
Yeah, I think that's one where there's been a lot of study, and I think that's where we're, especially we get into the what is going on.
Hmm.
Um, because again, like REM sleep comes up with like there's something that are going back and forth. There are theories about the whole left brain, right brain. When you're kind of using both, there might be something.
Hmm.
Um, at the moment, it's hard to say what exactly is the reason.
Happening.
Exactly. It's sort of we keep by finding more and more ways that we see how it works, it's getting us closer to that elusive answer of why.
Hmm.
Uh, I mean, so EMDR was first really like discovered because the founder, Dr. Francine Shapiro, I think the classic story, she was walking the woods, thinking about something, feeling a little freaked out, and she started looking side to side and just noticed that she was calming down.
Hmm.
So it's very much like we kind of accidentally stumbled into this. But when you strike gold, you're not going to just leave it around. So it's been, again, they're doing so much research. There's a lot of people now, they sell these like, wristbands that do the
Okay.
back and forth vibrations.
Oh, okay.
And people will even, I've known people who like will wear them during like public speaking. And that alone helps them feel calmer.
As a way to, in a sense, self-regulate.
Exactly.
So you said that um, during an EMDR session, the patients do most of the talking. Is it just that, um, well, you already said that you intersperse some things if they get stuck, but is it largely that you're there as a way for them to stay grounded?
Yes, it's largely I'm sort of like the ref is almost what it is. I let them know when they can start, I let them know when they can stop, I kind of step in if I notice things getting going off. And also yeah, just keep them grounded so that because doing EMDR by yourself is not recommended.
Okay.
It's important to have a clinician who is trained to be able, especially just because there's a big factor with any type of trauma work,
Hmm.
as I'm a like trauma informed and trauma practicing, like therapist, there's just like a lot of considerations you have to take in mind. So it's sort of those extra things. But it really is that like I'm the ref
Mm.
because even to the client themselves, like again, I was talking about like sometimes they'll like your thoughts will go somewhere like, why am I thinking about that? And then you'll go through a couple more rounds and you'll go, oh, that actually
That's
connects
why
with
that
this.
popped up,
Exactly. The client themselves doesn't know why it's coming up.
right?
I'm certainly not going to know, and I don't want to interrupt. I don't want to get in the way of what's happening. So it's sort of this that's where the art kind of comes in. It's like this almost like beautiful creative moment of neither of us know what the destination is,
Hmm.
but if we trust in the journey and have a ref here to make sure we're staying safe on this journey, you get to some really exciting new places.
Kind of going off of that, how is it that you yourself ended up in EMDR specifically, but more broadly, a therapy career in general?
Yeah. I, came into therapy. I've been working in it for 7 years now.
Hmm.
In the field, I studied psychology in undergrad. I always had an interest in mental health. I knew I wanted to do something with it, but I didn't quite know what. I fluctuated through a lot of different things. Also, the reason I have a political science degree as well, because I kept changing my mind. But um, after college, I decided to go in to get some experience, see what it was like. So I started working at a substance use treatment center called
Hmm.
Haymarket Center. I was working on the crisis unit as a case manager. And that really began my career. I was working with a lot of people who were dealing with what we call dual diagnosis. Basically, they had a substance use issue
Hmm.
as well as a different mental health issue.
Hmm.
And on my unit, people were coming. We were the crisis unit because basically all of our clients came from hospitals. Either they had had a recent overdose, suicide attempt, psychotic episode, a whole range of different very scary moments going on.
Hmm.
Part of our job was helping them get to a stable place mentally so that they could then continue their, substance use treatment program and deal with all the things that are going on, but also like, when you're in crisis state, like hard to talk about those bigger things when so much is going on. And that experience gave me my first real introduction into working with trauma. And I just really felt a pull to it
Hmm.
because a lot of what they would teach you in undergrad is here's all the preventative things we can do with young people to prevent them having trauma. And the conversation's always kind of glossed over what to do when someone's already had a traumatic experience.
Right. I mean, trauma can happen literally from the day we're born, and we might not even be aware of it. So there's an importance to talking about prevention, but from an outsider's point of view, it seems a little unrealistic to be able to bank on prevention.
Absolutely. And I think that was the big thing of, when I left school, I immediately went into direct work. COVID happened very soon after. So, we were working under some of the worst circumstances possible.
Hmm.
And so really having a sense to see like, hey, all those things are great in theory, but there's a reality that things happen, trauma happens, and feeling like people are getting left out of the
Hmm.
conversation because, yeah, prevention's great, but what about when that didn't work?
Hmm.
And so I, worked with trauma for a long time and had heard about EMDR, had known people who knew about it. And so I was like kind of aware. And I was like, what is this thing that they keep talking about? And so when I started going into private practice, I got involved with it, especially because I was looking for more treatment options for clients where I'm like, hey, not to knock other forms of therapy, they work extremely well, but I was looking for something like I need something a bit more effective because again, I'm getting a little tired with the answer of here's how you prevent trauma. I'm like,
Hmm.
but what about when it happens?
You wanted something that was a bit more radical in terms of be able to intervene and help somebody.
Yeah, absolutely. I think a big approach I've always had to therapy is I don't believe in any idea of like no one like there's no one that can't like heal themselves.
Hmm.
I don't believe that. I in essence refuse to believe that. And so, when I'd run up into issues of like, oh well, this can't treat that. I'm like, well then we need to find something that does. And
Hmm.
so finding EMDR of like as you said, a radical solution that is effective and it does not my favorite thing is it doesn't, balk at the big issues.
Hmm.
Someone comes in with severe and significant trauma experiences, EMDR doesn't go, ooh, that's actually a bit too much for us. That no, it's like, cool, we're here. That's what we do.
Hmm. So it could go from the deepest to, not to compare trauma to trauma, but just for the sake of speaking, um,
Mhm.
dipping your toe into the kiddie pool of trauma, so to speak.
Absolutely. And especially in that terms of like comparing traumas, because it is about like it's less the event and more how we experience it.
Yes.
It's like you said, like if you experience trauma from a baby and then say that same trauma over and over and over and over, even if that trauma was maybe what we wouldn't consider as bad as other things, that's gonna dictate and form so much of how you just see yourself and the world. And that is there are a number of therapists who will say that they don't really work with trauma.
Hmm.
And people specialize in things, that's totally okay. But like you said, I I don't like backing off just because someone's gone deeper into the pool.
Right. Yeah, that bit of experiencing the same thing over and over and it affecting how we see ourselves is something that I'm currently working through with my therapist. Um, how might you suggest that someone approach healing themselves if they don't necessarily have the means for an EMDR specialist or therapy in general?
Yeah. It it's a great question because that is true. There's the reality of insurance costs, also just like life
Hmm.
circumstances for people, and it is very difficult. Um, I will say I'm gonna give a little bit of an unsatisfying answer to begin with. Of it's hard to give a blanket answer because everyone is so different.
Of course.
There's things that are gonna work for some people that won't work for others, and that's one thing I do want people to really take in
Hmm.
because I think a lot of people will feel shame that they haven't healed from something
Hmm.
that someone else has. Why is this affecting me so much more than this other person?
Comparing traumas.
Exactly. And that extra shame, that extra guilt, that is, and it's the reason I specialize in them, they really just put that trauma even firmer in.
Yep.
And so having that grace for yourself of you went through something, and that's okay, is really important. I think another big thing is being able to approach your trauma like you would approach your physical health in ways.
Hmm.
In that, if I had chronic problems with walking,
Hmm.
there are similar things of shame and guilt and those feelings that come up, but our society is a little bit more understanding because we kind of are like, oh, well, that's outside your control. We're a little bit, not always, not ableism, but we're a little kinder. With mental health, we're kind of like, oh, why don't you just get over that?
All right, pull yourself up by the bootstraps.
Exactly. And I very much recommend like approach it in the way of like this is something that you want to work on.
Hmm.
This is something that you want to address and build in the same way that like if I want to learn how to speak German, I'm
Hmm.
not going to be mad at myself for not speaking it on day one. You need to give yourself grace and time to keep improving. And really, I always just say like your focus is not the destination, it is the journey. It's not to be someone who is healed. It is to be someone who is healing.
Hmm.
Because when your mindset is, I'm going to be someone healed, anything short of that goal is a failure. And that makes you feel awful. If your goal is to be someone who is healing, that you are succeeding every time you're stepping along the way. And it also gives you room for when you fall back a little bit. It's okay that if I'm not perfect because I'm still trying.
Yeah, you just hit a little too close to home for me personally on that last
I
one.
apologize.
No,
Yeah,
no,
if
no,
you want,
no,
if you
no,
want a
you're
minute,
all
that's
good.
fine.
No, you're good. You're good. Hey, I'm the one who asked to interview a therapist. It was bound to happen.
Fair enough. Hard
Um,
for me to turn that part of my brain off.
Absolutely. So just as a last question here in our last few minutes, we've been talking a lot about traumas very broadly, kind of as a big blanket term.
Yeah,
Um, for someone who might not be as versed in therapy speak or might not have ever even dipped their feet into their traumas, what would you broadly define it as?
fantastic question. I would say a lot of trauma therapists, we love to say we call it big T and little t traumas.
Okay.
And we say that because so big T traumas are the very classic examples. The things you'll find in the DSM,
Hmm.
near-death experience, traumatic loss of a loved one, sexual violence, physical violence, emotional abuse. These are the ones like if you just said what it was, someone would probably go, "Oh, that's trauma."
Hmm.
Little t describes all those other things that still impact us, but maybe on its face we wouldn't call it trauma.
Hmm.
The definition I use to kind of just explain what trauma is, blanket statement, when an experience that alters how a person perceives and interacts with the world in a harmful way.
Mm.
So I'll say it again a little more clearly. Any event that makes us view and behave towards the world in a way that hurts us. So the classic example of someone who was in war, they have PTSD. When they hear a car backfire, they think they're hearing gunshots.
Hmm.
Their brain is perceiving a car backfiring, an auditory stimulus, as gunfire. It's telling you, oh, this thing you're hearing is actually this thing. And then the reaction is their heart rate goes up. They're getting that pump of cortisol. They're having in that survival mode. So their brain has changed how they perceive things happening and how they react to them. That's a very classic physical example, but there are the emotional examples as well. So someone who has spent their whole life being emotionally abused,
Hmm.
they might perceive someone yelling at them as, okay, I deserve this. And this is another sign that I'm terrible. Rather than perceiving it as like, that person's yelling, they're perceiving it as, I'm a terrible person, this is horrible. And then
Reinforcing their own narrative.
exactly. And so now they're having a reaction to it. Not the reaction of, whoa, why are you yelling at me? Their reaction oftentimes is shutting down. They just sit there and go limp and just take it because it reinforces what they already believe.
Mm.
And again, those like little T traumas, it's about how we experience them. So someone who made fun of me in middle school, if it was something that I didn't care about, and they said like, "Oh, ha ha ha, your eyebrows are too good looking," I'd be like, "Oh, okay, that's kind of weird, but whatever." But if that always happened, if every time I walked around, people were like, "Those eyebrows, man," it would start to really change how I think about myself.
Mm.
So it's that, especially like when trauma hits, when it hits our, weak points, that's
Mm.
where it really sticks.
That was a elegant description.
I'm glad.
Well, thank you for your time, Joe. I really appreciate this.
Yeah. If I may, there's one other thing I'd like to offer, if that's okay.
Absolutely.
One thing I'd also like to offer, because I think there's a lot of times people don't talk about the friends and family people who have experienced trauma,
Hmm.
how they can help. I think a lot of us feel unprepared. And it can be hard because like again, like have a lot of experience in it. I'm just used to hearing it. So it doesn't faze me as much. But people who aren't, when you first hear about someone's trauma that can really, like
It's
you
weighty.
don't know exactly, and you don't know what to do. I kind of want to give some, if it's okay, some quick tips of what people who are helping out can do, if that's okay. Yeah, so I just want to give quick tips for anyone who is friends or family with someone who has experienced trauma and they're going through their own healing journey. Uh, the quick tips I want to give is first, there is often an impulse in us to help. And by help, we mean solve.
Hmm.
We see that someone is going through something terrible and we immediately want to do something to comfort them, to protect them, to make sure they don't feel bad about this. And that's a great impulse. It's the impulse, it's kindness, it's generosity. Um, the problem is it can be a little uninformed because when they've gone through trauma, there are no magic words to just fix that.
Hmm.
I have a lot of people will ask me, oh, what do I say to someone who's gone through these things? There is no perfect thing to say. You're just sorry to spoil it, but like there's nothing you're gonna say that's gonna make that trauma not feel terrible. And so your goal is not to say the perfect thing.
Hmm.
Your goal is to make sure they don't feel alone. A lot of things with trauma is we kind of just have to at some point face it. We just have to face it, we have to process it, and we just have to be able to sit with it a bit. And for us on the outside, it can feel awful that we just have to watch our loved ones sit with it. Sometimes the best thing we can possibly do is make sure that they don't have to sit with it alone.
Mm.
So sometimes it's just if someone's telling you and says like, "Oh yeah, my brother died." Sometimes our impulse and you'll go, "Oh, I'm so sorry," and give them a hug. Sometimes it's better to talk to it for a bit more. My brother just died. Oh, how did he pass?
Mm.
What was his name?
So
Hmm,
being engaged with what they're telling you instead of jumping to the socially acceptable platitudes.
exactly. Because especially if they're telling you I think there's a small part of us that's almost like, oh, I need to get them to stop thinking about this.
Hmm.
They're thinking about it. They're thinking about it all
Regardless.
the time.
Hmm.
Exactly. So when you give those platitudes, it's really just stopping yourself from thinking about it.
Hmm.
And some
Comforting ourselves first.
exactly. And it's not from a malicious place. We really are trying to comfort them, but we're doing it the only way we know how, which is to comfort ourselves.
Right.
Sometimes it means you're gonna have to sit with that feeling they're having for a little bit. And I often say like try to remain neutral, just ask a few neutral questions, tell me more, how did it happen? And I often say always follow up with, and how are you doing?
Mm.
That's probably the last question you should give before you then go in for that hug. It's
Mm.
just because that is the trauma. It's how it's impacting them.
And going back to early in this conversation, the trauma is the stories that they're telling themselves internally in the aftermath, as much as it
Exactly.
is the event itself.
Absolutely. And so there's so many ways by being that loved one who, even though you don't understand what they're going through and you don't know how to fix it, but it's just there, the story they tell them afterwards is this was a terrible time in my life where I also felt loved and supported.
Mm. Well, thank you for those insights. I
Absolutely.
think I needed to hear those as much as the viewers will.
I'm glad. And in so many ways, I also just want to add our healing is social. We're social creatures. We heal socially. So getting to hear what other people are going through does so much for us.
Mm. Well, thank you, Joe.
Thank you so much, Jared. It's a pleasure to be here.
Thank you again, Joe, for sharing your knowledge with us. Joe Huey is a mental health therapist at Present Awakenings in Chicago, specializing in therapy that helps clients recognize their strengths and achieve their goals. I'm Jared E., and you've just learned more ways to get unstuck.